Threats still weighing heavy on their hearts.
Well, over the last month, 19 Investigates went looking for new things local schools are doing to make classrooms safer. And we discovered there's a huge demand for specialized training in crisis intervention.
Hannah Catlett talked to officials who've been through it and explains their effort to enlighten others.
Crisis intervention skills are especially useful to emergency responders working crime scenes and with jail inmates. But now, a shift in thinking.
You could train teachers in that too, right?
Sure they can.
Gary Clue is the chief of police at Akron Children's Hospital. He's been a champion for crisis intervention team training for years, successfully sending more than a dozen of his officers through the 40-hour course.
And it really takes that 40-hour course to really clearly understand all the different types of mental health situations that are out there and then be able to deal with them properly.
Lieutenant William Heilmeyer explained one of the exercises that he went through during the class.
They put this headset on you and you hear voices in your head, and you're hearing these voices. You understand what it's like for somebody that's suffering from schizophrenia, like why it would be very tough for them to do tasks on a normal day because you're like completely flustered.
These two went to Columbus at the beginning of the month to talk to educators.
I think that we are all facing the exact same problems. There are so many kids that are having a mental health crisis from all the things that have happened over the last few years, and they're not being identified.
According to the National Alliance of Mental Illness, 1 in 6 kids ages 6 to 17 are struggling with a mental health issue. Only about half receive treatment.
And then it becomes a problem later.
Left undiagnosed, mental disorders can lead kids to drop out of school, and a lot of those who do end up in jail.
Crisis intervention, a lot of times that T gets confused as like training, and it's really team. It's really just about bringing everybody together, creating those partnerships and that team aspect.
With police shortages the way they are now, Clue says it's hard to find time for officers to attend a week-long training. That was one thing they explained to teachers.
We talked a lot about training the SROs, but we also talked about the training could be for them as well. I saw people closing their laptops instead of to listen rather than to finish their emails. So we had them. They were definitely listening to us.
Which isn't necessarily surprising. Just look at this data from Neomed. Demand for the training is higher than ever before as the push for mental health awareness expands nationwide.
One of the administrators said, we're very good at being reactive, but we're not proactive.
Data from last year shows the majority of people going to the training are sworn officers. There's no breakdown that shows how many are working in schools as SROs. But we do know that right now, educators themselves only make up 1% of those trained.
I don't think that the trainers would ever turn down a district director or a district manager or any faculty member if there was space.
Clue says training sessions fill up fast, but he believes in it so much, he worked with organizations here in Summit County to put on additional sessions.
We can never say that this program is going to stop school shootings because we can't say that, but we know that it has an effect, a positive effect, a calming effect, and a program development effect that is going to help. And if we can come up with different waves, no matter what the wave of safety is that we can add to, whether it's education for the officers, whether it's the SROs, or whether it's education for the faculty, to come up with identification and understanding, I think it's going to go a long way.
Hannah Catlett, 19 News.
And you can see the breakdown of which police departments in your area have CIT trained officers, as well as where the training is offered. It's in this story on our website.